and lots of energy. How about online? Put it in the chat, guys. Hala, you can let us know. How's the energy in the online? Are you managing to? I know it's
12.
Zoom.
We have 12 from Ayat.
Ayat,
12 from Maria.
Maria from Brighter Communities.
22 from Katie.
Katie Sheen in Limerick. 22. We're going to give it to you. Who else?
Amazing from Siobhan.
Tracy. Amazing. Good. Well, isn't this hybrid thing amazing? Who'd have ever thought it works like this? Anyway, moving back to the quality of the partnership. So great that everybody has had a chat, that we've all connected, been inspired, learned some things. So let's just remind ourselves of the quality of these partnerships and why quality is important. And who better than to bring us back to quality than David Weakliam, who's been bringing me back to quality issues for a long time now. So over to you, David.
Thank you. So what we're going to do in this short session is I'm going to talk about quality partnerships, believe it or not. Hala is going to do after that a short presentation on the accreditation for ESTHER accreditation that we award for quality partnerships. And then we're going to be making some presentations to some partnerships that have achieved ESTHER accreditation status because of the quality of their partnership. So I was in a bit of a dilemma as to what to do here, because some of you have been coming along a long time. You've heard me talk about this many times. It's, oh, not again. But it's kind of so important. It has to be again and again. So we keep beating the drum. But I also know there's people here, maybe this is your first time, and this is a bit newer. So I don't really apologize for talking about quality. But maybe just at the beginning to say what it is we're looking at when we talk about quality. We use that word a lot. And we use it in the context of some of the work we do with our partners to improve quality of care. And that's, I'm seeing that as a separate thing what I'm going to talk about now, which is about the quality of the partnership itself. But just as an example, to sort of bring the two together, because they are very connected. And this is the example from our partnership in Mozambique, which focuses on improving quality of care in hospitals, which is what we've been asked to do by the Ministry of Health. But the success of it is, in my view, entirely related to the quality of the partnership that we developed over a number of years. So this example was the Mozambique president coming to Ireland in 2014. The embassy in Mozambique, Irish embassy, said, wouldn't it be a good idea to sign an agreement to collaborate in health? And we said, sure. And that starts a relationship. We didn't do much with exchange visits, nothing much happened for a couple of years, and we were wondering what they wanted us to do, and it wasn't very clear. So we said, okay, we wait. And eventually they appointed a new person in charge of the hospitals, and she said, I want you to work with us to improve quality of care in hospitals. That's a big problem. And that started the work, and then it took off because they were very much in charge, was their agenda. And just to give us one example, the success rate, we worked with 15 hospitals and we trained and built capacity in those hospitals. And each hospital identified its own problem, very relevant to what their own particular issue about quality, and they worked on it. And then the idea was that they would, through the training, institute measures to address that problem. So in this one example, I'm showing of the hospital where they said, the big problem we have is that there are 11 patients a month on average dying within 24 hours of admission to the medical ward. They want to do something about it. So that was their issue, and they went through the training. And at the end of the training, they'd reduced that to 4 a month. And we introduced them to a tool in Australia called Between the Flags, which is a tool for monitoring deterioration patients. And then they tracked their progress over the next couple of years, and they went from 58 deaths in 2017 to 34 in 2018 to 8 in 2019. And that was 2019. And then we went back for a couple of years until this year. We went back in July, and we found that still they're achieving those levels, those reduced levels. So the benefit has been sustained. So at the end of the day, that's what we're interested in, is the impact. But how did we get there? I believe it's a quality of partnership, and that's why we're focusing on that now. So remind ourselves what partnership is about. I think we've heard that through the different presentations. I think we're all familiar with that, but a lot of it is about the fact.
Minimize please, yeah, you can't see that.
Okay.
Yeah.
Yeah.
Thank you.
And so just reminding us that it's about relationships, about long-term relationships, and that's a real, I think, benefit of what many of us have in the health service, because we're in our positions for long-term, and we can develop these longer-term links. It's about shared vision, shared purpose, and working together towards that. And it's about commitment, mutual commitment. So when I prepared this slide, and this morning, Louise's presentation, she had a slide that had exactly, I thought, the same points, which was really about the current context of why partnerships are important. So I'm not going to dwell on this slide, but I think partnership is important now more than ever. And here I'm saying partnership, not just partnerships. But the world has moved away from this kind of, I think, a lot of this partnership approach. Countries much more acting out of their own country's interests, multilateralism under threat, the distractions of things like the conflict in Ukraine and now the cost of living crisis, meaning we become much more focused on some of our own challenges and less on what's going on in the wider world. Issue about global inequity really surfaced during COVID with things like vaccine inequity, the whole impact of the pandemic, health systems under real threat. And we sort of found that on our visits recently to my visits to Mozambique and Ethiopia, talking about just people are very tired and worn out after COVID, and really, it's quite their health systems have really struggled with that additional kind of burden, and then climate change. So Louise talked very well about those this morning, so that's good. I can move on swiftly. And I mentioned this morning about us where partnerships is really set in the context of the Sustainable Development Goals. And partnerships it's number 17, and to me this is the one about the how-to. 16 goals about what to do for development. Number 17 is how-to. It's two partnerships, and that's where we come in. So the question then is, well, what's a good partnership? It's all very well to say partnerships is a good idea, but if it's a good idea, then presumably it only is a good idea if we do it well. And so what is a partnership, and what's an excellent partnership, if that's what we're trying to achieve? And there's different dimensions of it. So would obviously bring in things like the whole area of development and aid practice. I was talking doing good in that sense of being good practice. Is our technical assistance, is that good technical work? Are we doing no harm? I mean, sometimes no harm to ask ourselves that question. Is it value for money? Going visits and the money we're spending going out, is it value for money? Are we contributing to sustainable health services? So there's different ways in which we might look at what makes for a good partnership. And I think since we got involved in partnerships and be part of the ESTHER Alliance, we've been asking these questions and looking at how we address them. And this is a slide taken from some of them a few years ago, and typical of the kind of questions that we're asking ourselves all the time. Are institutional health partnerships doing the right things? What types of IHPs have been most successful? How can or do IHPs embed change into the institution and the wider health system? What's the additionality of the partnership work? In other words, you can go and run your project, but by doing it through a partnership approach, what's the added benefit of that? How can we go beyond routine reporting of activities and outputs and challenge IHPs to think about impact, reach, lasting benefits, sustainability, and evaluation from the start? So typical questions. And as we went through it, I think we saw that there's different kind of domains or different levels. And when we joined the ESTHER Alliance, and I was looking at what all the other European partners were doing, a lot was about the projects. They were evaluating their projects, and that was all they were doing. So if the project was in training, they evaluated the training. And so how many people were trained and did they learn and so on, typical. And you need to do that. If you have a project, you use your standard monitoring evaluation approaches for that. But we wanted to look further than that. So well, what about the partnership? How do we measure that? What about the quality of the partnership? So that led us on to developing a charter for quality of partnership, which I'll come on to in a minute. And then our accreditation in ESTHER Ireland is linked to that. And then there's the TET principles of partnership. And I refer to them, they are really good. And if I had to pick between TET and ESTHER principles, I think TET really were nicely described. So I strongly recommend you go to that website. They're quite similar, but they different angles on it. And then the next stage then is, well, it's not just about the quality. You can have the quality is a lot about the process, how you work together. But at the end of the day, you do want impact, you want results. And that leads on to how we look at that. And that led to the development of another tool, which I'll talk about, called the effect tool. So we developed then through the ESTHER Alliance, working with them on the development charter for quality of partnership, and 8 parameters that you see there on this side that we identified as important for a good quality partnership. And if you follow these things, then there's a likely chance that the work you do through the partnership will be effective, more likely to be effective. So you can see, read them yourself, adherence to national policies and strategies, formal agreements, and we encourage MOUs, reciprocity, mutuality, joint and equal responsibility, capability, equity and respect, transparency and ethics. So we use that use it all the time. if any of you are applying for grants, you know this, we'd ask you, how are you adhering to this? And if we're not convinced, well, we want to know, are you really serious about this? Because sometimes someone might put in a proposal, it's for a project, but they're not really thinking about the partnership. And then we also use this for accreditation, which I'll come on to in a bit. So we have that in place, we use it, and I encourage you to be, if you're not familiar with it, to be familiar with what is in that. But then we just felt too that that's not answering every question, because we want to know if you have a good quality partnership, does that mean you'll have a good outcome? Will you get results? And what's the evidence for that? And how can we make the case for partnerships? So that led on to the work to develop this EFFECT tool that some of you will be familiar with. So we worked with a UK group, Capacity Development International. This is again through the ESTHER Alliance. And what we wanted here was to go that step beyond just looking at the quality of the partnership. And we set it out as to develop and test an evaluation framework for IHPs, building on existing evaluation frameworks and best practice, with a focus on indicators that capture whether the partnership approach has a lasting benefit. Because I think that's core to what we're all trying to do. It's sustainable improvements, not just quick results at the end of a project period, but long-term improvements in the health service. And we recognize there were a lot of tools to evaluate projects, not so much to evaluate partnerships, and that the evidence for effectiveness of institutional partnerships was not strong, both in terms of quantity and academic rigor. So lots of case studies, lots of anecdotal examples, but in terms of a really solid body of evidence that you could say, was that there? And we weren't convinced it was. And to seek to measure impact, reach, lasting benefit, and sustainability. And so so the tool that we developed was called the EFFECT tool, started in 2017, and we had one version of that and then a revised version last year. So I'm going to talk a bit about this because, again, encouraging you, whether you're familiar with it or not, but as a tool that might be useful for you in your partnership. So EFFECT is about effective in embedding change. It's designed for completion by the program partner. So it's a self-assessment tool. It's not for an outsider to come in and assess what you're doing. It's for you with your partners to look at how the partnership is going. So you assess from your perspective, they assess from their perspective, and ideally you come together and say, how does that look? And do we agree? Maybe we think we're doing well and you don't think we're doing well, but this provides a way of looking together at how the partnership is going. Focusing on a number of areas: effectiveness in implementation, effectiveness of capacity strengthening, embedding sustained change, and the added value of working in partnership. And basically it works through a series of questions and you rate them. So we just take one example, needs assessment. So the poor practice will be on the left, that it was done by the northern partner without involving the southern partner. So we've gone in and we do our needs assessment. We go in and look and say, this is what you need, this is the problem. Or on the other side, the best practice was that it was made jointly or solely by the southern partner and their stakeholders. In other words, they identified the needs. And so in the partnership, you're working to their needs that they've identified. So each of the parameters then has this scoring. And at the end of it, the way we had it designed was that you could then produce reports that showed something like this, that gave you a picture, a map of the results. And you could map on your results as the Irish institution, along with your partner's institution, and you could see, do they differ? So maybe you thought that it was very strong in terms of the southern partner ownership, but maybe they thought it wasn't good. And sometimes I think we will be surprised at the difference in perception about how the partnership works. We think we're working in equal ways, and probably maybe not directly to our face, but they might say behind the thing that actually no, they run it themselves and we go along with them and this sort of thing. So it can be quite hard to get to the bottom of that, and particularly when we're bringing in resources, they're reluctant to be critical. So this tool is hoping to help to do self-assessment in a way where ideally each would do it separately, and then you'd come together and look at doing it. Now, I think what we found with this, the tool was a bit long. I mean, these people are busy people, and I think it was hard to do, and maybe some of the concepts in it weren't perhaps clear enough for the people doing it. So then a couple of years ago, then we went back and we did a revised version. And this is now available on our ESTHER website. This is hopefully more user-friendly, takes less time to complete, and more accessible for those whose first language isn't English. And how to use it, and this is all comes with the tool. the questionnaire, the discussion guide. You can download it. It takes about half an hour to do. So the idea is that it can be done fairly quickly. And then that it's intended really to be shared between the partners. It's not for your donors or for other people. It's to do sort of an honest self-assessment. So if you're not familiar with it, I'd encourage you to have a look at it. And even if you just do it yourselves, just to understand, you could have a look at, you know, so what are the kind of questions you'd be asking yourself about whether your partnership is good, is working well, and is it not just adhering to principles of good quality of partnership, but is it doing the kinds of things that are likely to lead to sustainable change? So it produces a robust framework that allows institutional partnerships to assess and improve their own practice. It helps guide discussion about the quality of your partnership and identify potential areas for improvement. It doesn't replace routine project monitoring and evaluation. So that's important. You still need to do that, and this complements it. It's not something to replace it. So that's about that. Now I'll come back in a minute to the accreditation. So I want just to mention one other area that is part of quality of partnerships. We talk about equality in partnerships. We talk about bidirectionality. It's two-way. When we're in a partnership, they learn, we learn. They benefit, we benefit. We each have our own problems, and we can learn to each other. And it's a very good way of, I think, of when looking at that way of getting around this thing of we're here just to help them. And but a lot of the time when we went to partnership, we're focusing on the needs in the other country, because that's where the needs are primarily identified. So how do we then look at it in the reciprocal way? How do we build into the partnership learning for ourselves, and how do we bring that into our own health service? And whenever, I'm sure lots of you would say this, whenever you go to work in other countries, I think there's so much we could learn from our partners to improve care in Ireland. And just how do we do that? So we're working on that, and something we like to work with you on how we do this. And last year we developed a tool to help people capture the learning from their work in, not just in Partn, but any work that they're doing with partners or organizations in other countries, and to reflect on it and think about then how would you apply that in your own work personally, but also in the work of your institution, maybe your department in a hospital, wherever you are, or in your organization. So people start to think about it and because it's a bit more intentional, that we don't just assume, well, we benefit because we're involved. And of course, it does benefit our work, but be a little more explicit on how we bring back those benefits. And I'll just put in one example, I think that to me that highlighted it. After being in Mozambique in 2020, went to this hospital where the problem they'd had was very long waiting list for gynecology clinics, 60 days. And at the end of their project, they reduced it. And when we went back, we said, it's down to 20 days. I said, oh, that's very good. I said, well, by the way, that's for the second visit. In other words, they do one visit for about a week, and the second one is about 20 days, which is a much better indicator because they've had the treatment. So they really made it was a very good achievement. But when I came back, I then saw in the media that down in Cork, they got an award because they had the longest gynecology outpatient waiting list in the country. Exactly the same problem. And they got theirs down. How many days were they? To about a month. And I thought, well, now wouldn't it be nice to get those together, get the heads together and see how, to learn from each other. Same, we find in other countries, the same issues, waiting lists in emergency departments, poor outcomes from surgery, no different. How would it be nice that we don't just see, we don't always think that we can learn from them as much as they learn from us. So anyway, we're working on that. So just to say, we do have a tool developed, and we're just thinking how we might kind of help to bring back benefits into our own health system. So the last thing then is really just to say a little bit more about ESTHER Ireland accreditation, because we've moved, the way when we set it up first was that we did an audit. If somebody wanted accreditation, which was recognition that they were adhering to the standards under the Charter for Quality, we would undertake an audit with them, and then if they were successful, then they would be awarded ESTHER Ireland accreditation. Now we're moving to sort of an online mechanism to do it, so a little bit more of a little bit more self-assessment involved. So Hala,
Yes, I'm here.
Can you take over and introduce the audit?
Perfect. Can you hear me?
Perfect.
Great. So thank you, David, for the introduction. I will go very quickly over those slides. So as David mentioned, we have tried last year to simplify the accreditation process because we really know that you are busy health workers and you don't have all the time to go through this. So this is now shorter, and it is again for those who are joining us for the first time. It grants accreditation to established international health partnerships, and which show demonstrated highest quality of partnership and reciprocity. And this accreditation indicates that the partnership is committed to quality service delivery, influencing health policy, and creation of sustainable partnership, which will have a long-term impact on health outcomes in Ireland and also in the partner countries. Here is the quick overview of the process. So first of all, we will find the form on www.esther.ie. And the tool is designed to allow partners to self-assess their adherence to each key principle of the quality of partnerships, which is taken from the ESTHER Charter for Quality Partnerships. And partners are asked to state the source of their evidence for their answers. And then after that, after submitting the form, you will receive an instant feedback that will give you a quick overview of your answers and your adherence to those principles. But ESTHER Ireland team will review those submissions, and based on that, we'll go to 2 outcomes. So if we saw that the answers does not meet the criteria for accreditation, we will offer you a following up meeting to discuss your application and also to give you recommendations and steps on how to gain the accreditation in the future. But if you meet all the criteria, then you will gain the ESTHER Ireland accreditation, and you will be awarded a written letter and also a plaque. And this plaque, of course, you can use it for to display it in your institution, to show it to your donors, for applying to grants, and just in general to help you to promote your work, your partnerships work. So here are very quick screenshots on how to use it. So first of all, you go to www.esther.ie, and then on this menu on the top, you can see here there's a quality. You can click on that, and in this quality, you will see the different tools that David has mentioned. But for here, it's just the ESTHER Ireland accreditation. So after you go to that, you will scroll down in the page, and then you will find the form, and it's very straightforward form. You have all the spaces for your answers. You will be asked to provide the examples, and after that you click a submit, and we advise you to let us know so we will know. We go and check your submission. So yeah, that's the quick presentation from my side. And I will hand it over to you, David, to present some of those partnerships who went through the accreditation process and received accreditation.
Thanks very much, Hala. So that's the end of the presentation. So maybe we'll just stop there, and just if anyone would like to ask any questions. Are we doing for
Maybe just for one or two.
At what stage does the accreditation process take place? Is it after audit or feedback, or is it just on the strength of the partnership?
Well, we would say it needs to be an established partnership. That's the first question. Is it an established partnership? And the evidence for that would be things like there's an MOU in place, or there's some evidence of commitment between the partners to work together. And then it's at the point at which, as a partnership, you would feel yourself that, you know what the charter says, that you measure up, or you are applying those principles in your partnership. And that when you're doing that, then you can make the case and say, yeah, we think we're up to the mark, and then you apply. And then, I mean, the idea is not to set a bar that's impossible to reach, but it's really is, and it's not to be policing partnership, it's to really incentivize people to aspire to these standards of partnership, and in a realistic way, because we're not expecting impossible things from people, but I think it's the evidence of commitment and to show in practice how you're doing it. Yeah.
Thank you, David. Thank you very much for the great talk, and it's always good to talk about this, how to check are we on the right track or not? We are taking good partnerships. But when you use the tools and you said it's for the two partners to assess their performance,
It's the effect tool.
yeah, the effect tool.
Yeah.
So when they come back to discuss it, is there any kind of manual on how to do that politically, diplomatically sensitive way, just in case there is some discrepancy in the scores?
There's a manual for it. I think that's for the partners themselves, I think, to work out how to do that. If the quality of the partnership isn't good, that may not be an easy discussion. But I think if there's value in the process, it's just give you a reason to sit down together and talk about how the partnership is working. I don't think you'd always get perfect answers. When my experience of doing it was with Mozambique, and we found it was quite useful to see how they rated different things compared to us. And then areas where we thought maybe we could do a bit better, we talked about them. Now that took place, I think, in an atmosphere of trust and mutual trust that is there. But if that trust maybe isn't strong, that might be a bit more difficult. Okay, last one.
David, like, how often is it done?
Sorry, we can't hear the question.
How often is the evaluation done in partnership? Is it done like on an annual or 3-year cycle? Or...
Yeah, so the question is, how often is evaluation done? Well, that's for the partners to decide. And ideally what you do when you're planning your work, you would plan for when you would evaluate both the work itself and then review the partnership. I would say that it's ideal, it's good if the partners can be meeting together at least once a year. Now there are, to have the kind of good discussions, that is ideally something you do face to face. So that's maybe something that you would try and do during visits. So you build it into the way of working with the partner. But there's no fixed way of doing it. But I think it's trying to build it into your way of working, that the monitoring and evaluation is part of what you do. And it's thinking about the project, the work you're doing, the technical work, and then it's also thinking about the relationship and the partnership. Okay, so I think that's probably time to move on. And now is the time where we have the...
And David, just on the accreditation, every 2 years is the accreditation versus evaluation, which is with the partners. The accreditation takes place every 2 years.
I asked just, do you have any stats on how many partnerships apply for ESTHER accreditation versus how many receive it?
I would say that I don't have the stats, but I think that by the time partnerships apply, usually they're well ready, because they will often discuss with us about applying. We will often know them quite well, and we might sort of feedback to them, well, maybe not quite yet, or we might say, yeah, I think, you know, because we know a lot about them through if they've got grants, they report them back to us, and we'd have often quite a bit of interaction with different partners to know how they're working. So we would expect most would get, because they're generally doing it when they're ready. Now, if it's an online process and anyone can do it, that may be different, and this is a new process. So people may start applying who aren't really ready to do it. So we have to be looking at that carefully. So now I have the happy opportunity to make presentations along with Nadine. And these are for 3 partnerships that have been successfully audited and are awarded accreditation, ESTHER accreditation. And we'd like to present the plaques to them. And the first one is the Equals Initiative, which is a collaboration between the HSE and the Royal College of Physicians in Ireland. That's hosted in RCPI. And this initiative is involved in supporting medical training, development medical training in Zambia, and donation of medical equipment.
Would you like to say the first page?
Oh, I think if you'd like to say something, by all.
Sorry, I think it's got their connection again, right?
Joining. funding initially to develop the partnership when it was at a crucial stage, and we really didn't have a huge amount of funding from I would like to of course say that thanks is on behalf of all of my colleagues in our CPI, in the HSE, and our partners also in Zambia. We're at a stage now where we're reevaluating our partnership and looking to re-engage. There's obviously a bit of a lag now with COVID, but we're back out in Zambia in November, and we're really looking forward to strengthening the partnership and setting a new direction for it. Thank you very much.
Next is the Department of Public Health, the HSE Department of Public Health in Limerick, the Midwest Department. It was a partnership with the Lalgar Leprosy Hospital and Services Centre in Nepal. And on behalf, I think that's Emer Kwan.
Yeah, that's right. I didn't expect to have to say anything, but just like to echo the last lady's words. Thanks a million for a very enjoyable day, and it was great to meet everyone today. Thanks.
Right. To say about this partner, one of the strengths of this partnership is the way in which they've developed a very reciprocal relationship. And I know just last week they had 2 people over from Nepal to do some training in Limerick. So it's very much a bi-directional relationship, and both sides are benefiting from the partnership. And yes, and so it's well deserved.
Thanks very much.
And third is the Centre for Global Health, Trinity College, which is a partnership with the Sudan Medical Specialization Board. And to receive that partnership is Frederic Valliere, who's the director of the Trinity Centre for Global Health and assistant professor in Global Health at Trinity College.
I have to go online.
Is she still online?
I'm gonna let you talk because go on.
That's unfair. Thank you. Thank you, Fred, and thank you to everyone that was part of this partnership. Indeed, with the true commitment, the team spirit, the trust, the energy, the good faith, we managed to make it through. I'd like to thank you all, and I really wish I could have been with you. Thank you. Hello.
Sorry, no, but I think you're okay for everyone online.
Okay.
I think what you said. Thank you, Esther. Thank you, Nadine. Thank you, David. Just to recognize Dr. Sher as well. He's not here today, but it was very critical in this partnership as well. We've had this collaboration with SMSB going back 4 years before COVID, maybe. And 2 rounds of ESTHER funding has made that really possible. So thanks.
And do you want to say very briefly what you've done to the partnership?
Oh yeah, sure. So I suppose it was a very kind of intensive round of consultations, but we essentially, the first round of funding, what we did is we kind of jointly put together an MOU about some of the things that we wanted to accomplish. And come in here, if I'm forgetting anything, but one of them was actually kind of exchange of like classroom time between our master's students and the medical students and that are going through the accreditation through the SMSB. We also had trying to improve supervision. So all of the medical doctorate students had to do a thesis. And so we were trying to kind of strengthen the supervision for the research. There was a number of different things in there. What else am I missing, Ayat?
So yes, it was the research methodology course, it was the supervision guidelines, it was enhancing research and creating research days, and basically supporting the Educational Development Center. And for those who don't know, the Sudan Medical Specialization Board, it's the sole national mandated body that produces medical and health specialties. So if you like, it's like all the royal colleges under one umbrella. 40 plus specialty councils, and the Educational Development Center provides support for around 3,000 registrars annually. So there's the support that we provided together collectively with the mutual partnership of course, we learned a lot, affected around 3,000 throughout the years of the partnership, and including the final grant that we received 2018. Unfortunately, we couldn't go back due to the situation in Sudan, the first instance, and then due to COVID, we managed to purchase a software Polycom to also enhance communication virtually. So some of the few.
Thanks, Ayaan. Nice. Thank you, Noel. So nothing back to you.
Thank you, David. Thank you.